I am Vanessa Sena, and I am the CEO of My Local Chefs, where we create at-home healthcare using precision nutrition. In the world of diet-related diseases, a physician's inability to treat and monitor nutrition post-discharge results in health decline and substantial financial strains on payers. We first had this discovery when working with the Yukon Health's maternal fetal medicine team. They were not able to actually see what was happening with their patients with gestational diabetes and their nutrition program while they were at home. And we needed to find a way to create something for doctors to be able to monitor those patients. After working with Yukon Health, our solution became clear. We needed to develop a cutting-edge platform that enabled physicians to remotely monitor their patients' nutrition in real time post-discharge. We realized this when we were working with patients with gestational diabetes, where they only have a small time frame in order for them to get proper treatment or intervention that could possibly save them or their baby's life. When it comes to managing diet-related illnesses, medically tailored meals is at the top of the list to provide low-cost and high-value resources for patients to get better. As the research shows, medically tailored meals are one of the least expensive and most effective ways to improve our healthcare system in an equitable way. And Tufts University has come out with a research study showing over a 10-year period, $185 billion less could be spent on healthcare, and that's after food cost. So how does My Local Chefs do it? We team up with clinicians to understand patient population and their nutritional needs. We integrate with EMR, EHR records to be able to exchange patient information. We work with a team of local chefs that come from all different backgrounds to create different cuisines to satisfy your patient population's desires. We have dietitian support for nutrition education and what we call food literacy, and then we create your custom nutrition program. My Local Chefs has 3 pillars. We want to be able to provide healthy and delicious foods to your patients. We also provide nutrition education and what we call food literacy. And third is community. And although we do offer in-person cooking demos, community, and nutrition courses, we have a 24/7 access to online community for patients that cannot leave the home. In our communities, they are branded to fit a certain program where patients can order meals, look at recipes, cooking demos, workouts, podcasts, blogs, and other resources that fit their nutritional needs. An example would be patients with gestational diabetes would look at recipes that are only for them, dietitian and doctor approved for patients with gestational diabetes. For a patient that may have obesity and looking to lose weight, their online community will look different and tailored to their nutritional needs. As you can see, the market is big and only growing. A weight loss service market in 2022 was $2.8 billion, but an estimated clinical nutrition market in 2024 is at $72 billion. As you can see, the competition does not add up. All of our competitors in this space are either food providers that offer no software, no integration, no dietitian support, or are an integrative software and offer no meals that they can make on their own. They're not a food manufacturer. My Local Chefs is the only fully comprehensive company that offers medically tailored meals that are culturally diverse, delivered to any door, work with tons of different chefs, but also offers software integration and online community support and outcome data reporting. As you can see, we're working with some big players in the space, including Kaiser Permanente, Hartford Healthcare, and Yukon Health. We've generated $750,000 in revenue, and we've received grant money to start working on some pilot studies. Our team is big and led by the following: myself, Vanessa Sena, Erica Estrella, COO. She was the former CEO for Align International, a global nonprofit. Brian Ramirez, our QA supervisor, who's worked in an FDA regulatory industries, and Brandon Estrella, our lead engineer, former CTO for Marriage 365. Our advisors come from the Department of Defense, Small Business Development Council, and Rebecca Tuttle, our VP of Funding. She's raised over $31 million in her career. She's helped us get grant money, and she works with development teams from hospitals all over the country. Our team is also led by registered dietitians and, of course, the chefs from all different backgrounds coming from all over the state. Our clients include executives from hospitals as well, like Erica Mora, Director of Human Centered Care at Hartford Healthcare, and Greg Jones, Vice President of Community and Outreach and Engagement at Hartford Healthcare. We are looking to raise $2.5 million, and we believe that the best way to utilize the funds will be for a physical site expansion, clinical trials, software development, operating expenses, marketing and advertising, and IP. We thank you for taking the time to listen to our presentation. I am available at vsena@mylocalchefs.com if you have any further questions.